So the ideal requirements of the space maintainers are as follows. When we are giving space maintainer, the space maintainer should maintain the mesiodistal dimension. The mesiodistal, for example, here we are giving, this is the space maintainer. This space maintainer should maintain the mesiodistal dimension of the space. Mesiodistal dimension of the space. It should not interfere with the eruption of any tooth which is going to erupt. It should maintain functional movement of the teeth. And it should follow mesiodistal space, regain when required. For example, this is the distal surface of a tooth and this is the mesial surface of this molar tooth. So it should maintain, or it should allow the mesiodistal regain if we really want. And the space maintainers should maintain the mesiodistal dimension of the space. I hope it's clear. So now we are going to talk about how many types of space maintainers are there and how are they classified. Many authors have classified space maintainers in different ways. According to Raymond, he describes or he classifies space maintainer as a removable, as a complete arch space maintainer, or individual tooth space maintainer. Hitchcock describes it as a removable, fixed, semi-fixed, with band space maintainer, without band space maintainer, active and passive, functional and non-functional. Heinrichsen classifies as fixed space maintainer and removable. According to him, fixed space maintainer is again divided into class 1 and class 2, and then removable has no further classification. Shobha classifies removable and fixed space maintainer. We are talking about all of this individually, and we will be learning about what are the advantages and disadvantages of space maintainers. So first we are going to talk about the Raymond's classification of a space maintainer. Raymond says there are removable type of a space maintainer, there are complete arch space maintainers, and there are individual space maintainers. If you see in this particular picture, you see a space maintainer is given. Can you see here? This is a space maintainer. It is a complete arch space maintainer. Means it's taking support from all the arch. So we are calling it a complete arch space maintainer. We need space over here to be maintained, because this space, if we will not maintain the arch, the space will be lost. So this tooth is bonded, this is the tooth which is bonded, and a complete arch is applied, which will be fixed over all the teeth on the lingual side, so that none of the teeth shall move. It will hold all the teeth in the arch, will not allow the movement of the teeth into the empty space. This way it will maintain the space for this particular tooth, which is supposed to arise in the oral cavity. Then we have a lingual, as this is the lingual space maintainer, and there is another space maintainer that is called as extraoral anchorage. When we'll be studying further about other branches of orthodontics and the type of appliances, we will be talking about this particular thing. This is called as a face bow. You know, this particular appliance which is given to a patient, it is called a face bow. When we will be talking about a face bow, then we will know what does this face bow do. But one of its advantages is that we can use it as a space maintainer. Since we are getting support from outside the oral cavity, can you see via this strip, and the metal rod is applied that is present into the oral cavity, but the force which is generated, that is from these bones, this bone and the neck bone. The force which we are directing the force of skull, we are directing the force of the neck over the teeth via this metal face bow. So we call it extraoral, because the support we are taking from extraoral structure. We are not taking any of the tooth. We are not using any of the muscle of the oral cavity. We are taking support from outside the oral cavity, so we are calling it extraoral anchorage. So this is a complete arch space maintainer in which we use a face bow. And then individual tooth space maintainer. In individual tooth, can you see here? We are applying space maintainer via taking support from only a single tooth. So that's why we are calling it a individual tooth space maintainer. I'm repeating again, we have a complete arch space maintainer, and we have an extraoral anchorage space maintainers, and we do have a single tooth space maintainer as classified by Raymond. According to Heinrichsen, space maintainers can be classified as fixed and removable. In the fixed one, he says we have class 1 and we have class 2 space maintainer. I'm talking about fixed space maintainers now. In fixed one, we have class 1 and then we have class 2. In class 1, we have functional type of space maintainers and non-functional type of space maintainers. So in the functional type of a space maintainer, if you see in this example, can you see here? This is a lingual arch space maintainer that is placed over the lingual surface. So we are calling it a lingual arch space maintainer. And we do have a pontic type of a space maintainer. A complete crown is given over a tooth over which a loop is applied, and this space maintainer is maintaining a space. Can you see here the empty space is maintained, but a complete crown is placed over a tooth. So we are calling it a pontic type of a space maintainer. Then we do have a bar and loop type of a space maintainer. Here you can see only a band is applied. If you compare this picture and this picture, here the complete crown is placed and here only a band is placed. So this is a pontic type of a space maintainer, whereas this is not a pontic type of a space maintainer. This is a bar and loop type of a space maintainer. Okay, which is a band is applied over a tooth over which a framework of a metal is given, and this metal, can you see this particular area of this space maintainer is attached to this tooth, the first molar, and this will prevent the drifting of first molar into the space, and the pressure which will be applied, since this rod is attached to the tooth, if it is preventing the tooth to move in the distal direction, similarly the force exerted by this tooth will be applied or will be transferred via this metal framework over the sixth or first molar. Similarly, this first molar, which is stopped by the pressure produced by this tooth, will not allow the mesial drifting of sixth. I'm again repeating, if we focus on this picture, this banded tooth has a metal framework. This metal framework is placed over the distal surface of a first deciduous molar. This metal framework, which is attached with the first molar, will prevent drifting of the first deciduous molar. Similarly, the pressure which will be exerted over the metal by this first deciduous molar will be transferred via this metal rod to this sixth, the permanent tooth. And this counter effect will not allow the distal movement of sixth. So both the teeth will not drift into the empty space. Now we have class 2 space maintainer, in which we have a cantilever type of a space maintainer. This cantilever type of a space maintainer can have a distal shoe. Can you see here again? Now, this molar, the first molar is there, second molar is lost, and sixth is not yet erupted. So in this condition, we cannot take any help from the distal surface. Here is no tooth on the distal side of the empty space. So what do we do is that in this particular case, we are taking support from the tooth, which is mesial to the empty space, and after application of a crown over the tooth, we give some metal framework which is extended on a distal surface. This extension, the metal extension is called as a distal shoe. This is going in the distal direction, So we are calling it a distal shoe. So this is called the distal shoe space maintainer. These space maintainers are given when we know that there is no six erupted into the oral cavity. The exfoliation of the second, of you can say the first molar, because we are not talking about any particular tooth, but for example, second deciduous molar is exfoliated early, and we want to maintain the space for the premolar, as well as we want to direct the tooth which is six, which is not yet erupted. So we will give in such particular case a distal shoe space maintainer. Now, removal type according to Heinrich is a acrylic space maintainer. Can you see here a space maintainer is given? This is the empty space. A space maintainer is given with some of the teeth embedded in the acrylic, and they will be helping the normal function as well as maintaining the space. Here is another example of a removable space maintainer. Can you see here there is no tooth, and the space maintainer is given in this particular case, and that is attached by means of a clasp. Here is another space maintainer. Can you see here this acrylic framework is having some of the teeth. Such teeth are not present, means such teeth are exfoliated or they're not present into the oral cavity, which are supposed to erupt, and we need to maintain this space. And these holes, we have actually trimmed this particular space in this acrylic framework to help accommodation of the teeth which are already present into the oral cavity. Now, according to Hitchcock, space maintainers are classified as removable, fixed, and semi-fixed space maintainers. There again, the banded type of a space maintainer, without band space maintainers. Can you see here again the pontic type of a space maintainer is there. Here is only a banded type of a space maintainer is given, and they do have a bonded type of a space maintainer. Okay, none of the tooth is given any band, but there are bonded type of a space maintainers. Then Shobha Tandon classifies the space maintainer as removable and fixed again, and she classifies as a cast partial and wrought metal space maintainer, active or passive, functional and non-functional. And again, in the fixed one, it is classified as banded or bonded. As we talked about, these are the banded one. And if we are not applying the bands like this, then only with the help of kind of brackets, we are applying the space maintainer. This will be called as a bonded. This is not banded. This is bonded. This is banded, where the band is there. Okay. So, and functional and non-functional. I'll be talking about space maintainer when there is a premature loss of a deciduous tooth. When there is a premature loss of a deciduous tooth, either on one side, that is called as unilateral, or if it is bilateral. The space maintainers will be different for both. If the loss is unilateral, only one side, then there will be different space maintainers given. If the loss is on both sides, then the space maintainers which will be given will be of different type. So in the case where there is a only loss of first deciduous molar, we are only talking about first deciduous molar. In that case, what are the space maintainer can we give? And if the loss is unilateral, which type of a space maintainer will we give? If the loss is bilateral, then which type of a space maintainer will we give? For example, if there is a premature loss of a deciduous first molar, what will happen in this picture? If you see that the deciduous molar, the deciduous first molar, if this is space, you see the deciduous first molar here, it is lost, which was here before. The deciduous first molar is lost from this arch. What will happen? The second deciduous molar will try to drift into the space, and here it has drifted. What will happen when this is drifted into the empty space? The tooth which is supposed to erupt over here is first permanent premolar. This first permanent premolar will not give enough space to come into the oral cavity and it will lead to malocclusion. So can you see here these dotted lines are actually showing you where the tooth was before, and now it has drifted into the empty space, and due to drifting this tooth will be blocked or will erupt into the abnormal position. So in such cases where the first deciduous molar is lost before time or premature loss of deciduous first molar, one scenario is that the second deciduous molar will drift into the space. There is another reason that if the deciduous first molar is lost, so what will happen? The erupting lateral incisors, the permanent lateral incisor, which are erupting. For example, this is I say A, this is B, or this is C. Okay, here is the central incisor permanent, which will be erupting. Here is the lateral incisor, which will be erupting into the oral cavity. What will happen? The second deciduous molar, first deciduous molar is lost before time. This erupting lateral incisor will be applying pressure over the deciduous canine in this direction. This lateral incisor, the permanent lateral incisor which is erupting, will be applying pressure to the deciduous canine. This deciduous canine will drift in the distal direction, and this will lead to ditching. That will cause distal ditching. The pressure exerted by the lateral incisor will cause distal ditching of a canine, and this distal ditching will lead to midline shift. The midline will shift distally to the affected side. This is another scenario or the reason of a loss of a deciduous first molar or premature loss of a space due to the loss of a deciduous molar. One was drifting of the second deciduous molar was taking the space, or the erupting lateral incisor, the permanent lateral incisor were applying pressure over the deciduous canine, which was causing distal ditching. Due to that distal ditching, this space was lost again, and not only the space is lost, but the midline is shifted to the affected side. Okay, and blocked out canines, blocked out permanent canines may be the reason again of the loss of the space. So these are all the conditions which may arise due to the loss of deciduous first molar. So what is the treatment? If the loss is unilateral, the treatment is different. If the loss is bilateral, then the treatment is different. If the loss is on a unilateral side, on one side only, then we can give banded loop space maintainer. We can give individual tooth space maintainer. Okay, these banded loop space maintainers can be given. They are economical. They need less chair side time. They are ready, from the laboratory. We just need to apply, a bonding material over here. Oh, sorry, not bonding, but the banding material over here, and then we will be applying it over the tooth, and the rest of these components will be attached to it, and this way it will be maintaining this space. But they are only given when there is a unilateral loss. Okay, the disadvantage is of this unilateral banded loop space maintainer is they are non-functional. So they don't restore the mastication. They cause the problem in mastication. They cannot prevent supra-eruption of opposing tooth because they do not have any kind of occlusal stop. They are supposed to have occlusal stop in case if you know that the tooth in the opposing arch will try to over-erupt. So they don't have occlusal stops. Okay, so they cannot prevent supra-eruption of the tooth in the opposing arch, and may lead to slight mesial tipping if the loop slopes. Here, if the loop slopes, it may lead to mesial tipping of this tooth. Okay, so these are the disadvantages of a band and loop space maintainer, which is given in a unilateral loss of a first deciduous molar. What are the other type of space maintainers? They can be modified type. This band and loop space maintainer can be modified like this. Here we had only a band, and here we are having complete crown. This is modified type of a space maintainer. That is again a banded loop type of space maintainer, but here we are giving crown. This crown will be having one part of the attachment, and the second attachment will be attached to the tooth in the on the mesial surface, and this way this will be preventing the drifting of our teeth into the empty space. And again, we do have another space maintainer. Can you see here? It has some sort of occlusal stop. It has a occlusal stop. Sorry. It has an occlusal stop. If we see this occlusal stop will prevent supra-eruption of a tooth in the opposing arch. And we have another type of a space maintainer. These are called as bonded and band loop space maintainers. These are the bonded. Here it is bonded, and here it is again bonded. And both the sides, none of the tooth is having band present, but they are bonded and they are preventing the drifting of the adjacent teeth into the space. So these are different type of space maintainers which can be given in the case when there is a unilateral loss. What if there is a bilateral loss of the tooth? If on the both sides the teeth are lost, if there is a bilateral loss, then we cannot give those simple space maintainers which we talked about now. But in this case, we will have another type of space maintainer, different for maxilla and different for mandible. In case if there is a bilateral loss of a first deciduous molar in the upper arch, we will be giving Nance arch holding space maintainer. We can give transpalatal arch space maintainer, and we can give bilaterally placed band and loop space maintainer. So I'll be talking about this particular space maintainer. This is called as Nance palatal holding arch space maintainer. Can you see? This is called as palatal button. This button is given that is attached to the palate, and can you see here a wire framework is extended on the both sides to the right and left, where we are going to suppose to bend the teeth. Okay, so this space maintainer, what it will do on the right side as well as on the left side, it will not allow drifting of the teeth, and this way bilaterally it will maintain the space. And other space maintainer can be given into the lower arch. These are called as lingual space maintainer. We cannot give this type of a space maintainer into the lower jaw because it has a button. This button cannot be placed in the lower jaw because we know we do have a tongue, and there will be problem in the tongue, placement of a tongue. So in case if you're giving bilateral, due to the bilateral loss, if you're giving a space maintainer, you need to switch to the lingual arch space maintainer. This space maintainer is only having lingual arch, and it has nothing like this, no button. So this is the reason that the design vary between the maxilla and mandible because of the presence of the tongue. Nance, this space maintainer we are talking in detail. Nance palatal holding arch space maintainer is having a palatal button. It has a framework of the wire, and it is given in case where there is a bilateral loss of a deciduous molar. The purpose of, or the advantage of it is cheaper, you know, it is ready-made from the market, it is cheaper, and only what a dentist is supposed to do, just we apply the material, the banding material over here, and over here we will fix into the oral cavity of a patient, and patient, you know, there is no more chairside time required. But the disadvantage of this, it is a very skillful work. You need to have good skill. You need to have good skill to, you know, place this particular space maintainer. Another advantage of it is, once, it is cheaper. Number two, it allows transfer growth in intercanine region. This space maintainer, when we give in this intercanine region, this canine and this canine, in this intercanine region, it does not hinder the growth. It does permit the growth into the intercanine area. So this is one of its advantage. In case of deciduous molar, if we use deciduous molar as an abutment, it can also be used in here. This is the permanent tooth, which is used as an abutment. But in case if you want to use a deciduous molar as an abutment, you can give this particular appliance. Now we're talking about disadvantages. As I said, skill is required to place this appliance. This palatal button will be, you know, irritating the patient. It will be causing food accumulation, which will lead to inflammation of the soft tissue. In case if the first permanent molar is used in abutment, there is no transferred growth possible. For example, if you are using 6 as an abutment, there can be hindrance in the transferred growth. This growth will be hindered because this arch or this wire will not permit the transverse growth into this particular region. So this is the drawback of it. It does allow the intercanine growth, but it hindered the growth at the molar region, the transverse growth at the first permanent molar region. So this is its drawback. Transpalatal arch space maintainer. This was transpalatal Nance appliance. This is only transpalatal arch space maintainer. It can also be given. Only the difference is it has no button. So it means this will not be causing inflammation. Because of the button, we said there was fluid accumulation and can lead to soft tissue inflammation. But this arch one will not be causing inflammation. So it is more effective. Okay. And the disadvantage is that sometimes patient complains that the food get entrapped into this wire framework. But as compared to Nance, it has the advantage that there is no more food accumulation and there is less tissue inflammation. Now, lingual arch space maintainer, in case if there is a bilateral loss in the lower arch, then we give lingual arch space maintainer. Can you see here? Again, both sides, the bands are there, the bands are applied. This lingual holding arch will not allow these teeth to move into the mesial direction, and this banded teeth will not be allowed to move into the mesially, and the teeth which are in the forward direction will not be allowed to move distally. You see, this tooth, if banded, will not be allowed to move mesially, and the teeth which are having support of this wire will not be allowed to drift mesially. So this is called lingual arch space maintainer. This is cheaper than the band and loop type of space maintainer which we were giving in the unilateral loss. It is less irritating to the tongue because if it is well fabricated, because this wire, particular wire will be attached over the lingual surface of the teeth, so it will not be hindering the tongue. It will not be irritating the tongue if it is well made. Okay, the disadvantage is the wire can get disfigured. Once we give to the patient and the continuous eating and the movement of the tongue, or maybe with the finger pressure given by the patient to this particular wire, this wire may get disfigured. This is the disadvantage of it. We can modify this particular type of a space maintainer by giving this U loop, 1 to 2 millimeter U loop. Why are we giving these U loops? Because if we want any sort of distalization, we can achieve distalization by opening the loops. This is the only purpose to give the loops. This is the modified type of a space maintainer if we want to give. Now, what are the space maintainer if there is a premature loss of a deciduous molar? Second, first we talked about when there was a loss of a deciduous first molar. Now, if second deciduous molar is lost, what will happen and what sort of space maintainers will be given? What are the first? We need to know the consequences. If the second deciduous molar is lost, what will happen? There will be mesial tipping of first permanent molar. Can you see here? This is the first permanent molar. This first permanent molar will try to drift. Here, this is the first deciduous molar. The second deciduous molar is lost. What will happen? This particular tooth, the molar tooth, will try to drift into the empty space. The drifting will be more in the upper arch as compared to the lower arch. Because the molar, first permanent molar of the upper arch has 3 roots. Can you see here? It has 3 roots. And out of those 3 roots, the palatal root is long. This palatal root will make some axis on which the tooth will rotate. This particular root will make some axis on which this tooth will rotate. The rotation of tooth over the palatal root will be causing mesial tipping of this particular first molar, maxillary molar tooth. And this way, the space will be lost. Okay? And this mesial tipping will cause abnormal molar relationship. Can you see here? This molar, if we focus over here, normally the mesiobuccal cusp of upper first permanent molar lies in the central groove. Normally this cusp of the first permanent molar, this cusp normally comes over here. But here, due to the mesial tipping of this tooth, the cusp is gone forward. Normally, this is the first permanent mandibular molar and first permanent maxillary molar. Normally, the mesial cusp, the mesiobuccal cusp of upper first permanent molar lies in the central groove of the lower first molar. This is normal class 1 relationship. But here in this case, the mesiobuccal cusp is gone forward. This is not normal classification. This is not a proper molar relationship. So the consequence of the loss of the second deciduous molar is that the first permanent molar in the maxilla will rotate. The rotation will lead to mesial tipping of a tooth and will ultimately cause irregular molar relationship and more space loss in the maxillary arch. The space will be lost in the maxillary arch, and the teeth which are supposed to erupt in that particular space will be impacted, or they will go to some abnormal position, or they will be leading to malocclusion. What is the treatment in case if there is a unilateral loss of the second deciduous molar? When there is a unilateral loss of the second deciduous molar, what can we give? We can give reverse band and loop space maintainers. Why are we calling it a reverse space maintainer? I'm showing you the picture when there was a loss of first permanent molar or first deciduous molar. And now here is a loss of a second deciduous molar. The band and loops are same, but they are reversed. You see here, this tooth is banded, the deciduous first molar is banded, and the loop is going and attached over the 6 in order to prevent the drifting of 6 into the space. Okay, if you see properly, you will find that this tooth is banded and this framework is lying over the 6. Okay, This is the reason we're calling it a reverse one. I'm going to show you the picture. Can you see here? I'm talking about this one, unilateral one. You see here in this case, the 6 was banded and the loop was going mesially, okay, attaching to the 6 or the first deciduous molar. Oh, sorry, whatever the tooth is there. But if there was a loss like that, not like this one, means this way, the tooth, the second deciduous molar was there, the first deciduous molar was lost. So the tooth, the 6 was banded, and this way the framework going in the mesial direction. But in this case, when the second deciduous molar is lost, can you see here the first deciduous molar is banded and the framework is going to the distal direction. So that's why we're calling it a distal or reverse loop or reverse band and loop space maintainer. Okay, so this is preventing the drifting of 6, the first permanent molar, into the empty space. Reverse type of space maintainer may cause early exfoliation of deciduous molar. This is the deciduous first molar which was banded or which is banded. You know, this deciduous tooth is not that firm, and the space maintainer which is applied over it may lead to its exfoliation, early exfoliation. Okay, so this tooth may exfoliate early. This is the drawback of this reverse band loop type of space maintainer. Okay, as soon as the first permanent molar erupts completely into the arch, we shall remove this space maintainer. Treatment in case of a bilateral loss. The treatment before was due to the, in case of unilateral loss, this is the mistake I have, typing mistake. In case of a bilateral loss, again, we can give Nance arch holding appliance, or we can give lingual space maintainer into the lower jaw. Space maintainers for premature loss of deciduous second molar prior to eruption of the permanent molar. As I told you here, this picture I showed you here, the permanent tooth is not yet erupted properly. So in this case, when the second deciduous molar is lost and permanent first is not yet erupted into the oral cavity, then in such particular case, these type of space maintainers can be given. Or we can give a distal shoe space maintainer. Can you see here again, it's very clearly showing you that the 6 is not yet erupted and there is early loss of second deciduous molar, and we have banded the first deciduous molar, and we have given some extension of the metal that is called as distal shoe space maintainers. These space maintainers are given when the 6 is not yet erupted into the oral cavity. Okay, in case of early exfoliation of deciduous second molar, when the 6 is not yet erupted into the oral cavity, we give distal shoe space maintainers. These space maintainers have a distal shoe. This is the horizontal component of it, and this is the horizontal component of it, and this is the vertical component of it. This horizontal component will maintain this space, the mesodistal width, okay, where the premolar is supposed to erupt. And this particular vertical extension or vertical component will be, maintaining a space for premolar, as well as it will be guiding the 6 where to come. Otherwise, if we will not give this extension, what will happen? 6 will try to erupt like this. So this vertical component is 100% maintaining the space needed by the premolar and directing the 6 to erupt into the particular place into the oral cavity. So these components, this horizontal and vertical component are made up of wire, and they are 1 to 1.5 mm that lies below the mesial margin of the ridge of unerupted permanent molar. Can you see here? It is lying below the mesial margin or mesial ridge. This is the mesial ridge of an unerupted first permanent molar. So it lies 1 to 1.5 mm below the mesial ridge of unerupted first permanent molar to guide its eruption into the oral cavity. Advantages: it guides the first permanent molar to erupt into the space, but the vertical component may cause tattooing of the teeth. This vertical component, which is placed inside, which guides the first permanent molar to erupt, it may cause metal tattooing of the gingiva. It produces tattoo on the gingiva. Or this vertical component may cause inflammation. Okay, so this vertical component, can you see here? This deciduous molar is banded. Horizontal component is maintaining the arch width, and this vertical component is projecting towards the gingiva or to the gums. So contraindication: when missing several teeth, when there are several teeth missing, you cannot give distal chew space maintainer, medically compromised patient, when there is a poor oral hygiene and where there is a lack of cooperation of the patient, we cannot give space maintainers in those cases. When number of teeth are missing, we cannot give space maintainer. When there is a medically compromised patient, we cannot give space maintainers. When there is a very bad oral hygiene, we cannot give space maintainers, and lack of cooperation. For every treatment, we need to have a cooperation of a patient. If patient is not well cooperated, we cannot give. Alternate procedures or alternate appliances for the medically compromised patient other than distal chew. So these are other type of appliances we give to the medically compromised patient when we cannot give distal chew space maintainer. So these are called pressure appliances. These are the pressure appliances which can be given to the medically compromised patient. And here the pressure will be applied on the area immediately below the mesial to the pre-eruptive tooth. The tooth which is not erupted, can you see here? With the metal work, this tooth is completely bended and this area is left open, okay, to allow the eruption of a tooth which is supposed to come into that space, and this will be acting as a guide for the tooth to erupt. Space maintainers for the premature loss of deciduous incisors. If the deciduous incisors are lost before time, what space maintainers can we give? We can give removable partial dentures. We can give band and stainless steel crown cemented over the tooth on the metal framework. Can you see here? This sort of removable appliance, if in case where there is a central incisor, where the central incisors are exfoliated before time, the deciduous one, so we can give acrylic partial dentures, and we can give a banded type of stainless steel crown, and with the framework, metal framework and acrylic teeth over them. So this way, what will happen if we will not give space maintainer? These space maintainers will not only maintain the space, but they will help phonation, they will help speech of a patient, they will give aesthetics to the child, they will they will be helping, they will stimulate the dentulous areas of the permanent teeth, and they will not allow the mesial drifting of the teeth, they will not allow midline shift, and they're functionally passive, and they help the proper positioning of the tongue. These are the multiple advantages of the acrylic space maintainers in case when there is loss of incisors, the deciduous incisors. Disadvantage: they need time to time removal. For example, in this case, can you see here, this space maintainer is given. Can you see here? Here are the deciduous, the teeth are lost, and now We have trimmed them. Before we gave some deciduous teeth, oh sorry, some artificial teeth over here. Okay. Now when we know that when there is a time of eruption of the permanent teeth is near, we need to trim these spaces. We need to leave them open for the permanent teeth to erupt into the oral cavity. So they need removal of acrylic on the edentulous areas, timely removal. Every time, every 6 months, we need to remake another, acrylic denture to allow transverse growth. And children always try to play with the space maintainers. They may lose it, they may break it, or they may not wear properly. And such space maintainers may lead to poor oral hygiene, or they may be leading to the rampant caries. If the class, in case if we are giving class with these removable space maintainers, these clasp, they restrict the lateral jaw. Clasp, if they are not incorporated or if the clasps are there, they will not allow the lateral jaw growth. So these are the disadvantages of removable space maintainers. Space maintainers in case of loss of deciduous canine. What are the consequences? Delayed eruption of permanent canine, tilting of a permanent incisor in the lingual space, lateral incisor leading to ditching of a canine, as we talked before. So in such cases, again, we can give band and loop space maintainer by taking help from the deciduous first molar. In case of the bilateral loss of canine, we may use lingual arch space maintainer, or we may use Nance arch holding appliance space maintainer. Can you see here? Here is no canine, and we are using Nance or arch holding appliance, but this is not with the button. This is only the loop type. Or we can give a lingual arch space maintainer in case of the lower jaw. Here, can you see the metal rod is attached over the incisors, and the molars are banded, not allowing the mesial drifting of the molar, and this way these teeth will also not be moving, and that will be guiding the eruption of a canine as well as maintaining this space. Thank you so much. If any query, if you have any problem, you may contact me on my email address, and you may contact me on my given number. Please like and share my videos. I'll be very grateful to you. And inshallah, I'll be uploading more videos on orthodontics.